could that help?
What do you mean it's not just about strength training?
So, can I just exercise through it? I guess, the thing is that with mobility, you're looking at strength and range, whereas if you don't have either, then you're going to have some sort of problem down the track.
Okay. We're here, Hopscotch Fitness, beautiful Hopscotch Fitness. We've got co-founder Wiki here with us today. Had a little bit of a look on your website to figure out what you were qualified, and I realized there was quite a few things. There was over 15 items on the list at which Wiki here is qualified. So just to name a few, she's a certified personal trainer, so Cert 3 and 4 in fitness. She's a mat Pilates instructor as well, and you're also a check coach too, I believe.
That's correct.
This is just 3 of the 15, so have a look on the website for a few more. So here at Hopscotch Fitness, you're a co-founder with Louise, who's behind the scenes here. Yeah, just taking it with BTS. So Hopscotch Fitness started in 2006, and they believe that fitness should be fun and challenging. It should be simple, yet complex when needed. And the philosophy here at Hopscotch Fitness is that taking a holistic approach towards health and fitness. Is that?
That is correct. That's spot on, and that's how the name came about. So think of the game hopscotch.
Yeah.
It can be simple.
Yes.
Or it can be complicated, and you can manipulate the game to what you need, and that's how the name came about.
I love it.
Yeah.
I didn't actually know that.
Yeah. There you go. Fun fact.
Learning on the fly. Now, speaking of learning today, Wiki, we're here to chat about neck pain.
Yes.
And about training. First question for you: can I train with neck pain?
The answer is yes, but it depends. So, of course, it depends on what's happening. How serious the neck pain is, how severe it is, and whether we need to get it actually medically cleared, or whether it's an issue that we can work around and then help get better and build. Eliminating things like sit-ups and things like that, where a lot of people tend to want to use their neck and their head,
Yeah, we don't want
and
that.
reducing those movements and actually doing other core exercises such as like dead bugs and other things that, even then.
What's a dead bug?
Ooh, what's a dead bug? Oh, well, we can show you that later.
If you only had 2 exercises, I know you mentioned dead bugs before. So if you had one other exercise that if you suspect one of your clients is having neck pain due to poor posture, what might you do? What's another exercise you might throw into their workout?
In terms of it, would I then jump into an exercise, or would I look at some sort of, mobility work / stretching?
Mobility.
Yeah, so I guess, oh no, exactly. How could that help?
What do you mean it's not just about strength training?
So, can I just exercise through it? I guess, the thing is that with mobility, you're looking at strength and range, whereas if you don't have either, then you're going to have some sort of problem down the track. You can probably push through it. So what we want to do is, before we start loading, I'm going to look at it going, how can we open up, say, we talked about again, opening up the chest and the shoulders.
Yes.
To allow our back to work better,
So
to
what
create
might be
strength.
one that opens up through our back?
Brilliant chest stretch, which most people actually do incorrectly.
Okay.
So chest stretch is a good one, and even some mobility work around maybe shoulders. I would also look at loosening up the thoracic, so your upper back.
Okay. So you're going to be showing us the dead bugs, you're going to be showing us chest stretch, and you're going to be showing us some thoracic mobility.
Yes, absolutely.
So thoracic, we mean middle back, yeah?
Yep. So if we get Fontaine to turn around for me, we're looking at sort of this section here. So what happens is a lot of times we don't have a lot of, movement, whether it's flexion, which is bending forward, extension, which is back, or rotation. Now, when this area lacks that movement, the lower back and the neck has to compensate. So we want to basically create a bit more movement through here and strength through that mid-back to allow us to stabilize without overloading the neck. So that's kind of the stuff that we would be looking at.
Got it. So we should probably do this actually on the gym floor. But given that the camera's already set up, let's just talk about this anyway.
Yes. So if I am a person who has a neck pain and I have not been able to solve it with a simple heat pack, bit of stretching, it seems to be coming back. I've fixed my posture and it seems to be an ongoing issue. I would be looking at an osteo, a brilliant osteo like Fontaine, get her to assess it properly and figure out what is going on. And then if, and this is the brilliant work that Fontaine can do, is she'll give you the rehab exercises that you need and then move forward. Now, if say Fontaine goes, actually, you know what, it's not as complicated. We are going to do a small treatment to get ABC to where it needs to be. And then move, when you do exercises, you can then do ABC. So I would probably put more mobility work versus at the start, then work on the back work and core work as my program for the first few weeks and sessions. And then from there, I would then increase the rest of the routine and maybe reintroduce overhead based on what's happening there. Okay. What are your thoughts? Because, I mean, you've got experience in osteo and PT. What do you think?
Oh, I love everything you just said in terms of making sure that we've got good quality of movement before anything. First and foremost, working on that mobility, kind of that active range of motion, right? It's all well and good to have mobility, to have that range, but can you use it? Yes. Do you know what to do with it under load and under tension and under pressure? Yes. So I think that's extremely important. But before all of that, we need symptomatic management. If it hurts, you need to get that looked at. We need to get that addressed so that we can stop doing something funky and holding ourselves in a funky position. And get back on the gym floor. Speaking of getting on the gym floor, we're going to go through dead bugs. We're going to go through those movements, chest stretch and thoracic mobility. And if you could give us a couple of cues about what we might be looking at, what we're doing, that would be great.
Awesome.
All right, let's do it.